Hello, and thank you for your interest in my teaching project. My name is Brian Thompson, and I'm a nursing student at Gateway Community College. Go Geckos! I'm here to present to you Recognizing the Pulmonary Embolus. The goal of this presentation is to educate you about pulmonary embolisms. With that in mind, I have two objectives. The first is that you'll be able to verbalize the seriousness of them and when to get medical help. The other objective will be that you can list and recognize the risk factors associated with them, signs and symptoms, and preventions, if any. So you may wonder what a pulmonary embolus is. Well, simply put, it's a blood clot that ends up in your lungs and blocks the main arteries, preventing blood flow. They usually stem from a deep vein thrombosis, also known as a DVT, that usually forms in your legs. Eventually, the thrombosis, or clot, breaks off and travels up the legs, causing a life-threatening situation. If not treated promptly, it can quickly lead to death. That's why it's so serious to be able to recognize the pulmonary embolus. In fact, 500,000 people are diagnosed with the pulmonary embolus each year, and 200,000 of them die. Of those 13,000 die from lack of treatment. Recently, tennis star Serena Williams was diagnosed with the pulmonary embolus, showing that it can compromise the health of anyone, no matter the condition of their physical fitness. While it's not necessary to remember all these risk factors, it is important to look at these and see if any apply to you. Some of the risk factors here are unfortunately unmodifiable, but the good news is some are. So for this slide, it's important to understand and notice your own risk factors that apply to you. After recognizing and understanding the risk factors, it's now time to put some attention to how to try to prevent them. In the hospital settings, people may get put on heparin or Coumadin, which are anticoagulants, to prevent the blood from sticking together. Also used, even more frequently, are called pneumatic compression devices. These things alternate between the legs, compressing the muscles to promote blood flow and to limit the blood from pooling up. After surgery, it's advised to get up and get moving as soon as possible. And if on prolonged bed rest, doing range of motion exercises will help in reducing the risk of developing a DVT. Since being overweight is a risk factor, regular exercise may reduce the risk not only of a pulmonary embolus, but of many other health issues and diseases. And if you must travel, it's a good idea to do leg exercises, such as flexing the legs or getting up for a quick stretch every so often. Drinking plenty of fluids will equally be beneficial. Here's the important part. Know the signs and symptoms. If you do, it can be the difference in prolonging your life. So reportedly, the most common of the symptoms are chest pain or chest wall pain. I recently had a friend diagnosed with a PE, or pulmonary embolism, and he said it felt like he broke a rib or two. Also, there may be anxiety, difficulty breathing, at rest or not. People have said that it's a fear of impending doom, or you just can't take your breath. These are all warning signs that something has gone wrong, and it's time to get checked out by a medical staff. So along with the ones I mentioned, you also should get hospitalized if you have a cough with blood in your sputum. This is another sign that something is not right. Unfortunately, we're not all the same when it comes to signs and symptoms. So many of us have these, while others may not. Listen to what your body's telling you, and do not be afraid to be wrong. So again, if you have a combination of symptoms from the above, especially chest pain, shortness of breath, or cough with blood, go to the hospital and tell them Brian sent you. When you get there, you can expect any or many of these things to be ran. These tests are very important in the diagnostic process. Typically, the diagnosis is made on multiple tests and not just one. A chest x-ray will typically be normal, as well as an electrocardiogram. These are used first to rule out other issues like a heart attack. A CT scan is an injection of dye put into the blood that will give a good view of the lungs to show if and where any blockage may be. Now, a VQ scan, it's a very common test for this diagnosis. It tells whether the inhaled air is equally matched to the blood flow in the arteries. It'll only show if there's a low, moderate, or high possibility of a PE, and it's not definitive. The pulmonary angiogram, on the other hand, this is the gold standard. This can diagnose a PE, but it's invasive and sometimes the risks far outweigh the rewards of the diagnosis, so it's not commonly the first choice or even the second in some cases. Also commonly used is the D-dimer, which is a blood test that tests the breakdown product of a blood clot. Depending on your own situation, there are many treatment options a healthcare provider may choose. Anticoagulants prevent future clotting and continuous clotting. Clot busters, called thrombolytics, break up the clot and have a high risk for bleeding and have many contraindications. The next two are surgeries. The embolectomy, or clot removal, is typically a vein to remove the clot. A person prone to clots and pulmonary embolisms may need a vein filter called the vena cava filter, where it prevents clots from passing higher than the filter location. So that's about all the time I have for you today. This is just a quick review. Remember to keep an eye on your risk factors and any possible prevention. Pay attention to what your body is telling you by recognizing the signs and symptoms. And lastly, do not be afraid to go get yourself checked out. Again, pulmonary embolisms can quickly cause death, so play it safe. Again, my name is Brian Thompson, and it was wonderful to get to share this information with you. I truly hope it was beneficial. Thank you for being a part of my teaching project, and please take great care of yourself.